quite exciting for her, and she hits all of them. She never misses a doctor's appointment. So you'll, at some point in your career, you'll see a lot of geriatric populations because they realize what they need to do to keep themselves going, and they're motivated. A lot of geriatric populations aren't working. Some are, but they have the schedules that are accommodating for it, versus younger people who might have to schedule it. And if you're doing a good job, even us, your age group will show up going to the chiropractor. But eventually, as they continue to age and they continue to, prosper in life, they're going to get older, and you want them to continue coming. So eventually, you'll always have it. Just like if you're dealing with young people, when you do a good job, eventually they start reproducing and they bring their kids. So it's just a great way to continue on. So you definitely want to take care of elders. And at this point right now, I just want you guys to all kind of just think of who's an elder in your life. How would you want them to be taken care of? Just think about it, whether it's your grandmother, whether it's your parents. Some people's parents are older. Your great-grandparents, your aunts, your uncles, cousins, anybody in your family. What do you see in them? Is their health good? What are their characteristics? What are their behaviors? What do you want to be mindful of? I notice with my grandmother, anytime she does something weird, I notice it. I'm on it because I see her every day and her doctor may not. Okay. So the objectives that I want you to know from this intro is you need to know the definition of frailty. We'll go over that. You need to know the components of biological aging, the 3 functional categories of the elderly population, very important, and identifying the characteristics of aging. Because believe it or not, elders are different from us. Obviously, sometimes they can look different, but chemically, biologically, there are some things that change as you get older a lot of times. And there's no typical older person, but there are things that show up as we age. All righty. So did you know, our senior or geriatric population, when we say that, we're talking about people 65 years or older. So, and they basically represent about 15% of chiropractic practices on average, sometimes more or less. And typically, a lot of these demographics, they can afford chiropractic care. They'll budget it in. Some live close to the clinic, and some have their own transportation. So a lot of times, they're great candidates for your practice. Sometimes they're great candidates to sustain your practice. So, and what do I mean by sustaining your practice? So some practice members, depending on how you practice, some people will do wellness care, some will do like PI and all of those different types of things in specialty clinics. And some of you will have just general practices. Sometimes the geriatric population, some people will come and go throughout your practices. So for an example, some of you have moved to Dallas to go to school. So you might have all the doctors for Dallas, but if you move away, you're going to need another set of doctors. So some people are coming and going. And then there's other people who are laying roots who are going to stay. Typically, your geriatric population is pretty established and they stay. So they may need the same doctor for 20 years. You never know. All righty. So the leading causes of disease in the elderly, and this is in America, are heart disease, cancer, chronic lower respiratory disease. So at some point in a lot of them, your patients, you will see heart disease, cancer, and chronic lower respiratory disease. I will say a lot of your geriatric population who subscribe to necessarily the chiropractic lifestyle or the wellness lifestyle, a lot of times, many of them will be healthier, others won't. But typically, most people in the U.S. run into these things. Suicide rates are as high as 48.7 in 100,000 on older white men. And then the death rate from complications associated from a hip fracture are approximately 15%. So when I tell you this population is motivated a lot of times to come in, you can actually help them quite significantly, keeping their independence, their balance, all of those different types of aspects. All right. Because recovery time is different for elders if they have an injury. So nearly 40% of people age 65 and older have one disability. Okay, so you remember when I told you to think about your elders in your family? That's one of those things. Like, for an example, my grandmother, she's pretty independent. She lives in her own house. She does all different types of things, but there's certain things she has to like ask the neighbor or ask one of us to do. My grandmother is old school, so she don't even drive. So we got to go get her or go to the grocery store and things like that for her. She's capable of doing those things. But one thing that my grandmother does need help with is like She can pay her bills really, really well, and she can calculate her stuff really well, but sometimes she needs us to double check in case she makes a mistake. Or sometimes she needs us to read documents over to her. She pretty much understands them, but sometimes she does need help with those things. And over 15.7 million people, 2 out of 3 of them say they have difficulty walking. So think about the elders in your family. Does anybody have difficulty walking? Because it's very common. Okay, so this is important, and I guarantee you will see it throughout the try. So learn it, or if not, it'll bite you. Okay, so according to R.J. Shepard, physical training for the elderly. Okay, the elderly population is divided into functional categories, and right now we have 3. There's young, old, middle old, and old old. I know, very like specific and captivating, the names. So young old people, and it can be ages 65 to 75. So you can try to group them by age, but sometimes there are some 65-year-olds who look 45. So, and all of those different types of things. So sometimes you can't always just go by their chronological age. You have to look at the person to determine that. Just like some of you were like 14, but you may have looked older. It's just the way it goes. So young, old, they can participate in recreational and activities, and they can hit all their ADLs by themselves. So these are the people who are fit. Sometimes these are your mall walkers. These are the people who pretty much live in their life independent by and by. Then you have your middle old. So they're independent with their ADLs, but they need assistance with demanding tasks. So even though my grandmother is and this is ages 75 to 85. So my grandmother is about 75. And so she's pretty independent, but she may need assistance with demanding tasks. So she might fall into this category, or she might fall into the first or somewhere in between. So they may need your help with gardening. They may need your help grabbing things for them. They may need you to carry things up the stairs for them. But for the most part, they got it. They can live on their own if they need to most of the times. And then you have your old. So this is all functional. So these are disabled patients requiring nursing care or just significant staffing and help. And a lot of times they're older than 85. I do know some 95-year-olds who move and groove at their own speed. So taking care of yourself definitely does have its benefits. Okay, so what's aging, right? So it's not just what you see on the surface on their face and their hands and all of those things. So there's molecular and cellular damage. So to the DNA, as the DNA changes, there's a decrease in physiological reserves. There may be an increased risk of diseases because of these things, or there could be a general decline in capacity for the individuals, right? So some of you can run and jump and do all of those different types of things. In a few years, you may notice that may be different. Or before, when you were in high school, you could run like 2 miles or a mile and it'd be nothing, and you can recover and just do it again. Some of you may or may not be able to do that again. And sometimes it depends on your shape, and sometimes it just depends on your age, depending on what age you guys are in. But one of the things that definitely changes is as our DNA, we all study mitosis and meiosis, our DNA copies itself over and over, splices out what's not needed. It keeps what is needed. So most of the times, if there's an issue in that process, that can show up in our aging process, or as the telomeres get shorter, essentially they correlate that with age too. So the longer your telomeres and your DNA reproduction, and the healthier it is, the healthier you are, and the less aging that shows up as well. So there's just different things. Physiological reserves are definitely important. So older people synthesize protein different than you and me. Just like a kid, their body is going to be different from you and I. The same thing is when you're dealing with elders. So when you're looking at healing and all of those different types of things. So what's healthy aging? So it's the process of developing and maintaining the functional ability that enables well-being in older age. So it's like you want to get to the top of the hill and you want to stay there as long as possible. And even as you age, you want to age in a gradual way. So as you come down the hill, you want it to be slow, graceful, and in areas like that. You don't want to just drop to the bottom. Okay. So what are other characteristics? So there are usually age-related trends. And granted, sometimes these depend on, there's so many factors that can affect these. So how we age in the U.S. may look different from how we may age in Beijing. in different areas like that. So you have to take in cultures as well as practices and different types of things like that. So when we look at age-related trends, a lot of times they base it off one population or a certain area, but the trend could be different depending on where you are in different types of things. So for an example, age-related trends for African Americans who may fall into some of the things that are my demographics, or Puerto Ricans who may fall in some of my demographics may be different depending on different area. But as people age, there are some overall encompassing trends as well. So health-related behaviors and traits are things you need to be mindful of, skills. So what does that mean? Like I said, my grandmother can pay all her bills and things like that. That's pretty normal for elderly people. So you just need to know, like, if somebody's doing something, is this normal for elders? Should elders be able to walk? Should they be able to do these things? Just paying attention to those. There's psychological changes and risk factors. What's an example of that? I've heard people say, like, as Uncle Joe got older, he got mean. He used to be the nicest guy. Sometimes those things start to change as disease states and things happen. There's diseases and injuries. There's changes to homeostasis, so them being able to maintain their balance and chemically can start to change as well. And there are just some broader geriatric symptoms from aches, pains, and all types of weird stuff that may appear. All right, so theories of aging, right? So some people have an idea how they age. And there's so many theories that go on. So some people believe that it's genetically determined. So do you just have good genes? Is that a reason why Mrs. Robinson is 80 but she looks 60? Or do they take really, really good care of themselves and eat really, really well? But most of the time they believe that there's accumulated damage due to key cellular processes. So there's damages from oxidative metabolism, so your diet, pollution levels, toxicity. So chiropractic we call thoughts, toxins, traumas, all of those things. Or the glycation theory, which is super interesting, where they believe that, a lot of people, they go through glycolysis, where we have glucose in our system. They believe as we get older sometimes that this glucose starts to bind to things and bind to processes in the body, and it basically stiffens them up. It makes them harder, and it starts to cause the aging process. It binds to our proteins, and basically our collagen isn't as flexible as it used to be, and it makes us look old and slow down our processes with our organs and things like that. So these are all just theories. So some people believe it's the genes, some people believe it's how you're living your life, right, with the key cellular processes and the damages, glycation, all of those things, or it could be a combination. All right, so what happens at the molecular level? So changes in your protein can happen. You can have DNA cross-linking. You can have single-strand breakage. You can have changes in your DNA. All right, so and then at the physiological level, you can have organ system changes. So spine, this is something that you guys are going to come in contact a lot, and you're going to have great knowledge in it, because a lot of times you guys are feeling people's backs, you're palpating their spines. There are some palpatory changes in the spine as people age. Some people are less flexible than others, all of those different types of things. They can have changes in their respiratory system. I don't know if you've ever paid attention to the way some elders breathe. There are things that can happen. There could be musculoskeletal changes as well. The muscles can have be harder. They can have calcifications, genital urinary, their nervous system. Their nervous system can be overfiring, underfiring, extra sensitive, all those things. GI, endocrine, cardiovascular, all of those things can definitely happen at a macro level. And a lot of those disease states affect these things. All right, so what is functional ability? So, and we talk about function a lot in chiropractic. What are you able to do, right? So, adding those substances. So it's basically health-related attributes that enable people to be and do what they have reason to value. So can you do what you want to do, right? So I'll give you a perfect example. Many elders want to keep their independence, right? So their functional ability is extremely important. So if you're one of your values is freedom, you might want to get up and go whenever you want. So functionally, you may want to be able to walk So that may motivate you to do all the things that are going to keep you walking for a long time. And another one that is very big is driving. Elders at a certain point, some elders get their licenses taken away, and it's very catastrophic. It's very devastating to them, right? So maybe they may do things so they can keep and stay functional and they can stay independent. They may not want to go into a facility. So they may want those things, but are they physically able to do that? All of those different assets may have a factor. And then their intrinsic values and their environment plays a big factor in that as well. Okay, so frailty. And this is a definition that you do need to know because it'll come back. A progressive age-related decline in physiological systems resulting in decreased reserves of intrinsic capacity, which confers extreme vulnerability to stressors and increases the risk of a range of adverse health outcomes. So basically, they have less ability to adapt, and therefore they become more vulnerable to stressors and risks with their health. So that's pretty much how you sum it up. So you guys need to know ADLs, and we're going to review them. So what are activities of daily living? Because even as you go into clinic, these are things you're going to want to start documenting. So you have basic self-care tasks that are included in this. All right, so you have 3 categories: basic, intermediate, and advanced. And you do need to know the differences between them. So basic is pretty much what we think about. So that's bathing, dressing, doing your hair, grooming yourself, shaving, whether it's putting your, whatever it is, glasses, all of those aspects, feeding yourself, going to the restroom yourself, maintaining your continence. So, basically holding that together, and mobility level, and transferring within your home, getting around within your home. For example, my grandmother lives in I'm from the Midwest, so we have like a 2-story home, but we also have a basement. So she go up and down? So can Granny stay in the house, and can she go all the way downstairs, all the way up to upstairs? So I'll tell you, for example, my grandmother typically likes to stay on the main level of our house, or she'll go down the stairs because there's less steps, but she can go all the way up to the top floor of our house, but she doesn't really like to, because it takes time out of her, but she can do it. So being able to get around within your home is going to be a big, big, big thing, especially with elders. What are the intermediate ADLs? So IADLs, when you see that means intermediate. So this is pretty much doing things. So using the telephone is an intermediate, preparing meals, cooking for themselves, performing work around the house, doing laundry, shopping, transportation, self-medication, and managing money. So, I mentioned in my own family what are certain things that we help with. But, for example, my grandmother can do her own laundry. She can even do her own shopping. She doesn't like to, so she sends us out to do it. We're like our minions. I'm joking. We help. And she can take her own medication and different types of things, and she can perform most things around the house, or she'll just outsource them. She can use telephones. She can cook. She doesn't really like to. She just pretty much orders what she wants. So these are the things that, and if you look at these in living facilities, a lot of these things are taken care of for them. They may have access to the telephone, but they may not need to prepare their own meals. They may not do their own laundry or do all of those things, or medication. Sometimes people can pour them out for them, and things like money, they may not manage those anymore. And then what are advanced ADLs? So advanced ADLs are strenuous workouts and things like that. Heavy work around the house. The number of times you can walk a mile without rest, or you can walk a fourth of a mile without rest. So these are more just strenuous physical activities, versus the IADLs are really things that you need to be able to be functional in life, and maintain yourself outside of taking care of your physical person. So after you get through grooming and keeping yourself together and keeping your body together, what can you do to support that in your lifestyle? All right. So what is the general strategy for examining seniors? You need to consider the most common conditions. And we talked about, whether it's a heart disease, lung disease, all of those things. They can be arthritis, all of those different balance issues, things that you would think must show up in an elderly population. And we're going to talk about those throughout this class. And sometimes they're going to be things that you wouldn't think shows up in an elderly population. Like, for example, like UTIs, urinary tract infections. You may not think of that, so there are things you have to pay attention to. And then there's also common conditions, and then there's atypical presentations. So for an example, some things may show up and they're just not normal for the elderly population, that may show up in the regular population, or there's certain things that may show up in the regular population that may be catastrophic in the elders. So like, for example, everybody was talking about COVID and how it's affecting elders, for an example, at a rate that may be a little bit different, or they may be a little bit vulnerable because of frailty or because of we don't know why. Okay. There can be symptoms from drug interactions. A lot of elders are over medicated. And then they're screening for cancer if there are like red flags. In practice, I've seen quite a number of patients who've been diagnosed with cancer at different points in time. So those are things you may have to be mindful of, because the way you treat them may change. It doesn't mean you have to stop treating them, but how you treat them may change, and they may have to see other doctors for a while. So the 10 most common chronic conditions, this is something just to get familiar with. So guess what? High blood pressure, high cholesterol, they're at the top. Heart disease, then arthritis, big one, diabetes, and then you get into the things that are directly affecting the organs. And then depression is something that a lot of people don't really consider, but it can, and going all the way down to COPD and Alzheimer's. All right, in terms of the musculoskeletal conditions, you have your arthritis. So you have the OA is going to be the most common. Degenerative arthritis is the most common. There's RA, there's DISH, and I've seen it outside of school. Actually, I seen that my first year right out of school, with this older guy who was walking with a cane and he had his neck bent forward. You know, he came to dinner with the doc. I take his x-rays and guess what? There's DISH, you know, calcification of the ALL right in the front. And then there's crystalline arthritis such as gout and pseudo-gout. Gout can be pretty common, especially like in males or in you know, at a certain age. Osteoporosis, right? And that's particularly in postmenopausal females. And this is why it's going to be always be good when you examine them to ask them what medications they take and what is that medication for. Because a lot of times when people have osteoporosis, they're taking a medication to support that and their bone integrity. Paget's disease and fat pad syndrome, and that's a common cause of heel pain. So these are things you need to be mindful of, even for boards that they may ask you. All right, and then for the endocrine conditions, the number one is always diabetes. Then it can be hyperthyroidism and hyperparathyroidism. All right, and then for the cardiovascular, we have all these things: heart failure, coronary heart disease, heart attacks, hypertension, stroke, abdominal aneurysm. So I will tell you, I've seen a few of those. So like I've seen a couple AAAs. For different people. The first one I seen was in clinic, and the second one I seen was in practice. The one that I seen in practice, we still did treat them. We just had to do it tonally. But you can see all different types of things with as people age, and it was they typically were older people. I would say they weren't even old. They were like young old people, like people like in their 40s and 50s. Like who still look very, very healthy, with the abdominal aneurysms, the temporal arthritis, the chronic renal failure, and the incontinence. So some of these things you have to modify the way you treat them. All right, age-related changes to the spine. So you have changes to the disc. You have changes to the uncinate processes, the dural root sleeves, the spinal canal, and the Z joints. Okay. And this is why a lot of times when you feel people's spine as they get older, they feel so different. So the thing that you guys are getting a lot of practices on, you're going to FSA and you're practicing on each other, but a lot of you typically are within the same age frame. Okay, so if you have people in different age frames, try to work with them because you'll get a different experience. And granted, some people at different ages feel different. So my mother, who's in her 50s, my mom still runs like 5 miles a day, you know, like so, and different types of things like that. So she has a little bit more flexibility compared to other people. So their discs can change. So they can become dry. They can have literally little to no proteoglycans. And so as you get older, sometimes they don't have as many disc herniations. compared to younger people. So then, and with the changes in the Usane processes that can protect you from disc herniations as well as you get older. The dural root sleeves can be prone to stress injury because of the changes within them. And then the same thing as you continue to go on, you have osteophytes, all those different types of aspects that can go through. So you can go ahead and read through these things. The Z joints, where you're actually feeling when you're trying to adjust and things like that. Can become less mobile, and they can actually just feel just bigger and rigid and things like that. So, and you still being able to treat them, you have to learn how to modify. So do you do diversified on them? Do you do Gonstead on them? Do you switch to an activator? Do you do like tonal methods? Do you do soft tissue? All those aspects play a factor in how their body changes and how you treat them. And bone changes. After 40, bone mass decreases 5 to 10% per decade, and it's faster in women. So this is where we talked about the osteoporosis. So clinically, osteopenia is more likely leading to susceptibility of compression fractures of the spine. So if their bone is changing, right, if they can't handle a typical HVLA or things like that, how do you modify for them? Muscle and decrease in muscle mass and an increase in fat as they get older. So, sarcopenia, things like that. Clinically, decreasing muscle strength may also cause susceptibility to injury, especially if they have less muscle strength and then they want to get out there and do things that they used to do when they were younger. All of a sudden, grandmother who used to maintain her garden for years, she hasn't done it in 5 years, and then one day she decides she wants to get out there and do it, and she's trying to do it at the same level of intensity. It may be different for her. All right, so the brain, there can be shrinkage to the sulci and enlargement of different aspects of the brain, making them more susceptible to subdural hematomas with minor head trauma. So if there are changes to the brain and they fall and they hit the head, there might be something that changes different to them versus you, or if a kid, you hit your head and you just bounce back up. The peripheral nerves, sometimes they can have slower transmission. And there's and we talk about this a lot actually in chiropractic, with our nervous system and our spine and being able to adapt. So if you have slower transmission, your adaptability and your response time can actually change, as well as just your adaptability to stressors that happen as well. So think about your reflexes, right? A lot of times you guys are young, something can happen and you can reach out and grab them. If you have slower transmission, your reflexes may be different. So and a lot of times those reflex times help you in times of danger. So driving, something crazy happens, your reflexes kick in without you thinking. Or something may happen and a fall or something could be avoided because of your reflexes. If that's not as efficient on you, you might actually hit the fall, you might fall or do different types of things like that. Eyes and ears, so decreased accommodation. So changes with your eyes. So there's cataract surgery. Sometimes they're not able to pick up things with such sensitivity with their ears. So they may have difficulty seeing in noisy rooms. This may be why some older people have the TVs all the way up. All of these aspects. So there's so many things that change with the elderly population.